Ovarian cancer is a disease where some of the cells within one or both of our ovaries become abnormal and start to grow to become cancerous. The ovaries form part of the women's reproductive system. They are two almond-shaped organs that sit either side of the uterus. The ovaries are responsible for developing germ cells that later develop to become an egg. They are also responsible for creating the hormones progesterone and estrogen. Now, these hormones are responsible for creating a regular menstrual cycle, and they're also responsible for creating the typical female characteristics. Now, unfortunately, there is no early detection test that can be taken for ovarian cancer, so it's really important that women understand and look out for the signs and symptoms of ovarian cancer. These include abnormal bloating or an enlarged size of the abdomen area, pain in the abdomen area, an urgency to urinate all the time or more frequently than normal, and a real feeling of fullness after you've only eaten a really small amount of food. Other symptoms include excessive fatigue, lower back pain, changes in bowel movement, irregular bleeding or bleeding between menstrual cycles. Now, treatment is usually a form of surgery followed by chemotherapy. However, it is very individualized to the person and it is on a case-by-case basis. During and after your treatment, it is vital that exercise becomes part of your treatment management plan. Exercise should be a top priority while you're going through your treatment and after you've finished your treatment. Now, exercise helps to improve your bone mineral density. Now, this can be reduced during and after chemotherapy. It helps to improve cancer-related fatigue. It improves a person's tolerance to get through these aggressive forms of treatment. It helps to boost your immune system, which can also be lowered during chemotherapy. And it helps to improve your sense of well-being, your stress, anxiety, and potentially depression. Now, exercise does this by boosting your levels of serotonin and endorphins. Exercise has also been shown to potentially reduce the risk of recurrence after you've gone through your treatment. So it's really important that exercise is a top priority while you're going through treatment and that it becomes a habit into the long term after you've finished your treatment. Now, it's important that you discuss exercise with your oncologist, with your treating doctors, because there could be some considerations that need to be thought about before you start. It's important that you're referred to an appropriate physiotherapist and exercise physiologist so that your treatment can be specifically in line with the treatment or surgery that you've had. Now, you might also want to consider whether Medicare or a private health fund can help you while you're going through your physiotherapy or your exercise treatment. This just might take a little bit of burden off the financial side of things and help you to stay consistent with your exercise and your allied health treatment.